And indeed, doctors, nurses, and many other healthcare workers who are working in the front line are really the people that need a lot of help at the moment. You saw Dr. Omar Oluga there. He's the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union in that news story there. And I want to talk a little bit more to him about what it's like in the front line. Dr. Oluga, thank you for speaking with us this evening. I'll start off from there. Aside from the numbers, you've been speaking with your colleagues who are out here battling with this. What is it like for doctors, nurses, and many others who are literally working in the front line of this? What are some of the experiences that they're telling you about?
Thank you very much, Yvonne. First is to thank the President for recognizing the role of health workers in this pandemic and really in the whole development agenda of the nation, especially in keeping everyone healthy, and him being very clear about recruitment of additional health workers and setting aside 1 billion. I think that has to be commended, and we thank him for that. It's a very good start. Even though we also note that it may not be enough, but it's a very good start, and especially if used well. So I think coming to the issue of the workers on the front line, especially the health workers, to be honest, it's a bit frightening. I cannot say that there is any doctor or nurse or any health practitioner out there who is brave enough. What we have is that we, at this particular point, we are the ones that are tasked to protect this country. We are the ones that are tasked to be on the front line, to keep everyone safe. We are the ones that cannot stay at home when everyone is staying at home. And that means we are requesting everyone to stay at home while we are not at home, because that is part of the safety. So the person who is really going to be of help in this pandemic is first the citizen. But then the second line is that health worker, and they're a bit frightened, but of course they put on brave faces every day. We are trained to work in all humanitarian crises. There is not a single doctor or nurse or any health worker who is not trained in any humanitarian crisis. And I think the world is going through a humanitarian crisis where no one can really help you. It is just our expertise. Right. We are also lucky as a country that we were not the first country to have cases of coronavirus. Yeah. We were nearly the 100th country. So we have learned from other countries, and I can say as healthcare workers, have the enough knowledge and expertise to deal with this pandemic. And we are requesting all doctors and nurses to respond to the need of the country at this particular time. Okay,
Daktari, like you say, it is frightening, though you're up to the task. But some of the stories we hear is, about training, about equipment. So talk to us about that. Where is the training at? Yes. Do you feel like your members have the right training? Do they have the right equipment? Are there enough face masks, protective gear for you as well? And also talk to us about the number of ICU beds. We did a Twitter chat with you last week, I believe, and you talked about those numbers. So just paint for us the picture in terms of training, equipment. Do you have enough ICU beds, considering hospitals are also dealing with persons who have other ailments, from diabetes to cancer and quite a number of others. And indeed, the big question about ventilators that we're hearing are so important in the management of COVID-19.
Yes, Yvonne, indeed, that is why I added the word frightening, because the disease is new. And for us as health workers, what is most important is that we know the healthcare system, and we know that our healthcare system is not the strongest. In fact, time without number, we have been out asking the public and asking the government to strengthen the healthcare system, to make it a bit more facilitated in terms of equipment. We have been talking about this ICU capacity in the country. So indeed, one of the challenges that we are having is that not all healthcare workers are very confident, because not all of them have been trained. I think last week there was a lot of trainings that went on, but then I think it stopped. So I think for many counties, nearly only 1,200 were trained, and then we have not seen additional trainings. So we have not yet reached all healthcare workers with training. And number two is that even from the Council of Governors, the protective materials that were distributed to counties are not enough in number, and also I think the Council of Governors is even questioning the quality. So that puts healthcare workers at a lot of risk. Also, we are having issues with the clinical management. I think not many doctors, nurses, and other health practitioners have been told very clearly that this is what happens when you get a case. So we are still having a challenge with dissemination of information from the ministry, although today we saw some new guidelines have been released, but we're still having a lot of challenge with that dissemination. We have a lot of challenge also with the capacity of the hospitals. You remember that the hospitals still have other patients. There are still pregnant women who are going to deliver. There are still people who are going for dialysis. There are still cancer patients who cannot miss their chemotherapy or radiotherapy. So there is the burden of providing the regular health care, but then also there is this other issue about coronavirus. So you also do not know which patient is at risk. Remember, some of these cancer patients have traveled from abroad, either because they were being evacuated or because it was their time to come home. Some of them have been attending for treatments in places such as India. They have also been traveling. So there are lots of issues. The ICU capacity that you've talked about, we have less than about 200 ICU beds in the whole of the public healthcare system. These ICU beds, it's not that they are waiting for patients who will be critically ill from COVID.
Full.
These ICU beds are already full. So, and we are not seeing a lot of effort in terms of talking about, are we acquiring new ventilators? How are we going to man them in terms of critical care nurses, in terms of critical care doctors? How are we going to be procuring oxygen? We have already seen the global supply chain of protective materials has gone up. Even sanitizers, we've already seen the way the prices shot up. So if we go to a level where we have a lot of patients who need ICU, for example, then we are going to have a very huge challenge, not just in the workforce, but also in the capacity of the infrastructure, and also even in procurement of issues such, stuff such as respirators, oxygen. And I think this is really where we need to work on now as a country. I think we have concentrated on the pre-pandemic preparedness in terms of disease surveillance. The government has been very keen in advising the people stay at home, the curfews, the social distancing, the hygiene measures. Those are very, very good, and we urge everyone to take them. But then there is the preparedness in terms of the clinical setup. And the clinical setup includes the workforce, includes the medicines, the commodities, the protective materials, the ICU capacity, and I think we still have a very huge gap. Yeah. And right now, this is the time to really do it. We are very late, and that's why we need to recruit these healthcare workers, but also we need to be seriously talking about what's our ICU capacity. Are we increasing the number of ventilators that we will be having?
Absolutely.
Because this is the biggest challenge that we are going to face, especially when the numbers increase.
When the numbers increase. Thank you very much, Dr. Uma Oluga.
Yes.
Kenya Medical Practitioners, Pharmacists and Dentists Union, we thank you for making the time to speak with us. Please do stay safe, you, your family, and we continue to thank you and the entire healthcare fraternity for the work that you're doing on the front line of this battle.